Howdy, 10 days after sinus surgery. Here's some follow-up thoughts. Number one, fear not being able to breathe after surgery because you're packed. I chose an ENT that does not do packing. Yay! And I woke up, I was able to breathe. Though that night I was congested, and you probably will have some congestion issues for the first 4 or 5 days. Some of it due to the body's being bruised and swollen, rebound, some of it due to the scabbing and clotting that's going on from the recovery. So choose an ENT that generally does not pack their patients. Go for a second opinion for an ENT, not your primary physician. Make sure that you have a CAT scan, and I chose an ENT that did not rush me into surgery, and we tried some fairly long-term methods to try and resolve my problem. I had a 3-month sinus infection. And ultimately, after having on and off issues, not terribly serious, but on and off issues for 10 years, and a sinus infection that would not resolve, I went for the surgery. Pain. How painful will it be? Well, for my surgery, we did the ethmoids. He opened up the maxillary sinuses. He straightened out my septum, and he shaved my turbinates. I pretty much got a full sinus makeover. Except for the septum, I don't think it would have been very painful. The septum area, especially the bottom of the nose, the bottom half of the nose is very sensitive. There's numbing, it kind of vibrates, it kind of numbs your teeth a little bit. It's really sensitive. There's stitches going through it, and that's probably the most discomforting part of the surgery. I pretty much took pain pills the first day to help me sleep, and then I just stayed with Tylenol. So I don't think the pain would be very bad if it was just the turbinates and working on the ethmoids and opening up your other areas for better breathing. It's the septum, in my experience, that was the most sensitive. But by day 5, I was, that was the day I felt, some pretty good improvement. And for the most part, I've been able to breathe through the process. And today's day 10. Rinsing. I think it's really important to rinse. I rinsed 3 times a day. If I got up in the middle of the night, I rinsed, and I used 2 bottles, not a half a bottle of the Nelmed, a half bottle each nostril. I find that's not enough. And when I went back for my post-op in 7 days, the doctor was really pleased that I managed to clear out a lot of the junk that normally he would have to clear out. So I found every 6 or 7 hours I was doing my rinse, and it was pretty helpful. Recovery. Really wasn't told to me before the surgery, but it's a long recovery. So even though you could feel better in a couple days, you could be back to work in 4 or 5 days. In 2 weeks, you could be exercising. The nasal septum and your nasal areas could take really months to heal. And so I would be cautious about, doing anything that can hurt your upper area from a physical perspective, sports and so forth. But it's a longer recovery. It's a longer full recovery than I anticipated. But I'm glad I had the surgery. It's 10 days out. I'm breathing well. I think what's interesting takeaway is that there are times when I'm breathing through my nose and I don't even know I'm breathing. That's a new experience. And there are other times where it feels a little tingly. I don't want to say burning, but tingly. And you'll feel it in here. You'll feel more air going up, perhaps because it's a new experience for you. So you have to adjust probably to a new sense of normal. The other interesting look back when talking to other doctors is with my particular doctor, the nurse said he had navigation on his endoscopic equipment, especially if you're going around the ethmoids and it's a delicate area. And she says it makes me go a little slower. My surgery was 2 hours. And that gave me a little peace of mind that he's really careful about hitting some sensitive areas. And, he always worried about what if something went wrong or if there was a side effect. But that didn't happen in my case. And I was pleased with the results so far. With my ENT, it's hard to choose sometimes who's quite the right doctor. You have to go by your gut to some degree. There's really not much information online, I find, when it comes to researching doctors. Some doctors are more communicative, some are less. Some have better support staff, some don't. I went for a slightly younger doctor that I thought would have really sharp skills with the newest technology. And I went for a practice that had their own surgical center downstairs. And for the most part, um, uh, you're going to be pretty well informed before the surgery. What I find is you're not going to get much hand holding that first week. You're not going to get, if you're going to call a doctor a lot, probably not going to get a lot of callbacks. They're going to tell you to suck it up for the first week. Sleeping on an incline was kind of tough, but you get through it. The first day is a pretty messy prospect, but you get through it. And I can't wait to throw away all the crap that I've been buying for my sinuses for the last 4 months. All the bottles, all the sprays, all the Q-tips, all the teas, all the herbs, all the gingers, all the spices. Oh my God. I am so tired of all that stuff. So hopefully I won't get any more sinus infections. I won't get congestion when I lay down. I'm breathing pretty well. I'm glad I did the surgery, and good luck to you.